So, the County of San Diego Child and Family Wellbeing Department is transforming its approach to prevention, creating better outcomes for employees and families. By prioritizing restorative practices and community engagement, the department moves beyond mandated reporting to identify culturally affirming resources that families need to have to uphold a kin first culture for equity and placement. And so the CFWB Office of Equity drives this shift through strategic partnerships with faith based, community based, and racial justice organizations. So, that is just a little snippet of kind of what we're going to be talking about today. And then let's learn more about Dr. Clark. And so on this next slide, we have a few bullet points, of course, a, a huge background that she has. And so I wish we could put all of it up here for you. But these are just a few bullet points about her. And so, Dr. Keisha Clark is a native to New Orleans, Louisiana, and evacuated to California in 2005 due to Hurricane Katrina. And so, growing up in the segregated South and experiencing a traumatic event uniquely positions her with lived experience expertise in cultural humility and trauma-informed practice. Dr. Clark's educational background includes an undergraduate degree earned at an HBCU in psychology and graduate degree in criminal justice and a doctorate degree in management with a concentration in organizational leadership. She leads the Office of Equity in San Diego County for the Child and Family Wellbeing Department, formerly known as Child Welfare Services. And so her priorities are supporting the organization's efforts to become an anti racist system, tackling racial bias, disproportionality, disparities, and equities, diversity and inclusion and belonging issues involving African Americans, immigrants, refugees, and other communities of color, as well as gender and sexual minorities. And so we are so excited to have you here today, Dr. Clark. And I know you guys are probably so tired of hearing my voice, so I will go ahead and let Dr. Clark take over from here. And we're so excited to hear what you have to say today.
Thank you so much, Casey. I am excited to be here to share with you all the transformation of our organization. Before we start, though, I'm going to advance to the next slide here. We're going to be talking about a lot of information that can be traumatic. And so I just want to take some time because we know that I'm going to model a lot of things as well. So, not just the content I want you to pay attention to, I want you to pay attention to the things that I do to model what could be helpful in your organizations. I'm talking about child welfare, but I saw the registration and I know everyone's not from child welfare, but this can obviously be used in other organizations. So the first thing I'm going to do is just acknowledge what's going on around us, locally, regionally, nationally, right? And hold space for that. So let's just take a moment of silence to just kind of ground ourselves and hold space for our communities around us, our colleagues, our neighbors, our families that we serve, and the families we're a part of. Um, let's take a moment to just really acknowledge that. Thank you so much for participating in that. And I did see the emojis, and that really helps to engage with you all. So thank you for that. So that is just one example of how you can acknowledge and hold space for. We're going to talk about internal things that we had to do for our employees, but we're going to also talk about externally what we needed to do for our community. And so just acknowledging is really, really important. You're welcome, Lucia. Um, I'm sorry, Johanna, that you can't hear anything. Um, just acknowledging what's going on. Many times organizations hope we can sweep things under the rug, we can ignore them, and things will be business as usual. But the truth of the matter is, we don't want it to be business as usual. And I kind of cringe when people, say that, because business as usual is upholding the slide that you see right now. And so I'm going to go into that. I want to go into the history after looking at this. Why did we have to change this? Why? Um, how did this happen? How did foster care become the first option for our families? How did separating families, removing children become the first choice and not the last choice? So you'll see in this image, foster care in child welfare, previously child welfare, was the larger. This is the mechanism we use to solve the issues of what we called neglect or abuse, and we'll talk more about that. How that was defined, and really got our families backed into a wall, right? Voluntary services. And again, I know that everyone's not child welfare, so I'm going to kind of tease it out. Voluntary services historically have been kind of, again, this do this and we will not, remove your children, right? Voluntary means I volunteered to do this, free will, right? But it was kind of this coercion. And again, I'll talk about how we changed that structure of coercion. And then prevention was our last method that we decided to use. And so, of course, dollars go into those larger pockets, right? The dollars were going to foster care and not so much prevention. And so here we are now. We are Child and Family Wellbeing. As you know, we've changed our name multiple times, right? Many still call us CPS, Child Protection Services. Some call us baby snatchers. Some call us the Family Policing Organization. You'll hear our families in our communities call us by different names, maybe child welfare. Child and Family Wellbeing is just our next iteration. But what I like about this name change is that we actually put structure underneath it. It wasn't just a name change where we were trying to get out of this reputation, this horrible reputation that we had. We actually were putting some structure behind it. So let's visit the history of how we start in child welfare and move to child and family well-being. So I want to just go down a timeline really quickly about, laws, right? These structural, institutional laws that actually made it legal to do these things, to remove children, to place them in foster care. And so many times our employees or our workers, our frontline workers, are sometimes in a crisis where you have laws, right? Federal, state, you have policies that are guiding your behaviors, what you're able to do. And let's not forget about our interpretation, right? Our bias. So I might read a policy and decide it's one thing, and my colleague may read it and see another thing, and we're taking different actions, right? And we're having different behaviors. And so we're going to start at 1935, the Social Security Act. And I'm not going to read these things to you. I just want to pull out certain things so we can understand again where we came from. And then we'll move to, how are we trying to correct? And as we go down this timeline, you'll see how we've tried to course correct each time. But it just didn't quite meet the mark. And I still believe we have more work to do. Even though we've done a lot of work with child and family well-being, there are still some things, and I'll name those things as we go through, that are still barriers, right? And so we need to continue iterations of restoration and healing for families. So the Social Security Act, Titles 4 and 5, I want to point out here home suitability. Uh, Many times in child welfare, in the child welfare services industry, we talk about people's, social workers' thoughts, again, that subjective nature of what is a suitable home, what's safe for a child to live in, right? From mattresses maybe on the floor to a torn screen for a window, to a dirt floor, maybe on a reservation. Um, what do we consider suitable, safe for a child? And there are many ways we can, when we find in the homes that there is something that might be, a danger, that we actually correct it rather than let's remove the child, right? And so this particular act really used that to give permission to remove folks. If you thought this home doesn't look like my home, our homes may not look the same. And so it would be on that person to decide whether this home is suitable or not. We're going to move down to the Fleming Rule of 1960, and that says abuse and or neglect required to receive services. So that is another thing. Remember, we talked about voluntary services, where it should be voluntary, free will, but we're saying that's the only way you can get services. And you have to get a case, you have to label yourself as abusing or neglecting your child for you to get the resources that you need. So again, that kind of backed our families into a wall to get what they needed. When there may have not been abuse or neglect, but that was the criteria to receive services. All right, we move up on the timeline to the Child Abuse Prevention and Treatment Act. This one introduced a broad definition of abuse and neglect. However, it did not address culturally distinct child rearing practices that often differed between child welfare workers and our families. So this is a really, really big one. When we think about culturally, here in San Diego, we have, as you know, very large population, immigrant population, refugee population, various cultures, languages. And when you are coming from different places, you are doing things the way right? And maybe not the way we see it in child welfare. When I came to child welfare, I was a social worker in 2015, and I remember the rule of, if you're going to spank your child, it needs to be with an open hand on the bottom with clothes on and can't leave a mark. I don't know who came up with that particular, definition of what, that particular discipline should look like. But I know that other folks use different ways of disciplining. And child rearing. If I'm coming from another country, one of the things I saw a lot, people would talk about medical neglect. Let's say a child's teeth might be rotting or something's going on and the family's not seeking out dental care. And I came up in my own head about in those particular countries, the diet that they ate probably did not eat away at their teeth like our really high sugar diet. And they probably didn't need to, or that wasn't a thing that you needed to go to the dentist every 4 to 6 months and things like that. So just never knowing, what is behind unless you have a conversation to understand, why are we doing this, right? I'm curious. And I would many times share that I am from the South. As you heard Casey say, I'm from New Orleans, and this is the way I was raised. By the way, I am a big kin first proponent because I was raised by my grandmother. And so I think about, look, how my home looked. Let's talk about home suitability. How my home looked as a social worker. How my child rearing was, and how my discipline was. And if I went into homes and used that lens, I probably would find that people were not doing what they were supposed to do because it didn't look like mine. And so it's really important to acknowledge the subjective nature of what could happen when we go in those homes. So let's move down to the Indian Child Welfare Act, ICWA, 1978. It highlighted the need for cultural congruence in placement. And so we wanted to, what we would find, and what I saw when I was a social worker back then, 10 years ago, was sometimes we would put a child in homes that didn't share their culture. So guess what? They had to eat different food. They had to practice a different religion or spirituality. And really sadly, because we were wanting to get kids, into homes, sometimes there were language barriers where the child didn't speak the language of the family. That is problematic, right? And so this was where we were thinking, okay, we need to ensure that we're placing kids with families that share their culture. All right, let's move up to the Multi-Ethnic Placement Act. 1994. It created legal protections to reduce excessive lengths of stay in foster care for children of color. All right. So again, you see that course correction, right? Where we wanted to put children in homes that were culturally congruent, but if we couldn't find those homes, guess what? They stayed in the system. So that was problematic too. So as we go down the timeline, I just want you to see the course correction that every time we had a new act, a new law, we found that there were bugs to work out, and we had to try to course correct. Let's move down to the Interethnic Placement Act of 1996. So this is where child welfare workers were explicitly encouraged to not discriminate against families wanting to adopt a child of a different race. So we went back to placing kids into homes that were not culturally congruent because we didn't want them in the foster system too long, right? Foster care drift. And lastly, the Adoption and Safe Families Act of 1997 required child safety. Now, isn't that again, subjective thought? What do you consider child safety? Right? And we see people parent very differently. If we watch, just not in child welfare, but just our families, maybe your siblings, right? And you parent very differently. I don't know if you've seen those movies or different things where you see the one sister or brother is, kind of looking at their other sister and brother like, you let your kids do that? And they're like, yeah, you don't let your kids do that, right? And so when we talk about child safety, and that is really subjective, right, about what we think safety is. But child safety would be the chief consideration in placement decision making. So it quickened permanency. However, it disproportionately impacted the termination of parental rights, especially among Black children. And so this is truly problematic when we are terminating parental rights. We've talked about timelines in child welfare, where if you have issues of substance use or mental health or other things like that, the timelines just aren't long enough, right? It didn't take overnight to get there, or 3 months, 6 months, 12 months, 18 months. And so if our parents don't get it together, their rights are terminated. That is so permanent, right? And what we've seen in adoption and these termination of rights, as we've engaged with families who have been impacted by the system, they share that their children are with them now, right? After they made 18, the children go back to their parents. And they want to be with their family, right? Also, when we see families may adopt a child when they're young and sweet and cute, and then when we see problems occur with identity, with culture, and that family can't, and they've been cut off from their biological family, the issues that it brings. So again, that was not the answer, right? We might think, oh, they're able to provide a stable environment, loving care, resources, this and that. But there's nothing like your DNA, right? And we're going to talk more about kin first and why that is really important. And it's kind of embedded of equity and healing when we ensure that we keep kids with their families. So where did this start, right? From the very, very beginning of this child welfare, before it was called that, we saw orphan train. So again, we're starting from the root, and we'll move forward, right, on how we're trying to correct these atrocities that have happened. So orphan trains, and as you can see, mostly white children were on the orphan trains. And it was really based on poverty, right? Families not having the money. These youth were maybe homeless, and things like that, unsheltered. And the orphan trains were designed to send children to families that on the surface looked like, oh, adoption, or, taking children in to help. But what we found later is that the children were actually used as farm hands. They were used to work, and they weren't taken in as a family member. And so that's where it all, started. And then we will move to how that demographic changed, right? From white children to, we see more and more, as we know, disproportionately Black and Native American children are in the system, the child welfare system, the most. So how the demographic changed. So talking about institutionalized racism, I'm going to talk about 3 levels of racism, and you have many resources that I provided. This is Dr. Kamara Jones' Allegories of Racism, and it's a TED Talk that, again, you'll have in your resources. But I just want to talk about the levels of, how these impacted our child welfare system. So institutionalized racism, we talked about the law, right? The legal, structural ways that these particular things were able to continue. So the initial historical insult, structural barriers, inaction in the face of need, societal norms, and biological determinism. Let's take a look at one example of institutionalized racism. I don't know if many of you are familiar with this, but this is a very popular image of what happened with Native American children with boarding schools. And so this is the same person that was renamed Huston Tohai, and going through boarding school, right? Tom Torlino. Yes, Evangelina, very much, very much, very much so, very heartbreaking to break the identity, right? Kill the Indian, keep the man. Someone decided there was one way, one culture to be, right? And this particular culture was not the one, that something was very wrong. And again, I want you to think back to our previous slide when I talked about subjectively, someone decides what's right and what's wrong. So this is an example of institutional racism, where again, you have institutions with upholding these kinds of things. And then we have internalized racism. So you can imagine, once the institution has, again, gave license for us to do these kinds of things to families. And again, we can also think about when we offer courses or classes for families to take, right? Anger management, parenting, these things. Again, when we look at that curriculum, who's deciding, what is the parenting standard, right? Who's deciding these things? There's not just one way. Once you've done that institutionally, you can imagine that the person is now experiencing internalized racism. And we'll see our families have accepted what the institution put on to them, right? They have internalized it. Like, I guess I don't know how to parent. I guess I don't know how to love my children. And I thought I turned my Teams off, but sorry about that. And so they begin to internalize that. So it reflects the systems of privilege, societal values. It erodes the individual's sense of value. So when we see families kind of give up, or feel, and again, we'll talk about how we tried to course correct these things. And maybe in your pre questions, we talked about empowering families, right? Um, Families already are empowered. We need to help them identify that, right? When we are talking about empowering families, we're saying we have power to give to them, right? And we're trying to move away from power over and really move to power with. And so when we see our families have a eroded sense of value, you're really tired and exhausted, right? To do all of the things that we're asking families to do, to jump through hoops, to go to the classes, to take this test, to go to this court and go to the hospital, and just it's really exhausting. And we can really mistake that for they're not engaged, they don't care about their children, they don't love their children, or they will do anything. But I want to also say that we are systems that are interdependent. When I was, again, working as a social worker, I noticed that my families were a part of multiple systems that were interdependent. So I had a family who had a child welfare case. They were also receiving public assistance like CalFresh or food stamps. Someone was in the household that was in probation. Someone was in the household that was also in the sheriff's department's files, right? And so I'm thinking, wow, all of it is just connected. And we have to realize we're not the only one asking them to do all of these things. They're also trying to do all of these other things that they've been caught up in these systems, right? And it undermines collective action. I want to repeat what someone shared with me in a anti-racism session, and I always bring this up, and I want you to remember this. It's really important for us to not just use memory, and to also remember history, because memory is very short term. But we have to go back to history. And when we see, thank you for that emoji, when we see our families reacting a certain way, and we see them responding a certain way, we have to know that is history, right? That is history still there. And so I was in a Kin First Culture conference, and I remember the trainer said, when people say, oh, a participant said, what do you do if a family is non-compliant? And he said, well, maybe reframe it from non-compliant to they're protesting. And what do we do when we protest? What are we saying? Someone has done us wrong. There's some wrongdoing. I feel like there's some wrongdoing that has happened, right? And so we need to really bring it back to how we get here. What are the messages that are playing for our families, right? That are causing their current responses. So as we see, I saw something in the chat about family separation beginning with Native and Black families from the beginning of nationhood. Absolutely. So when we see you had this auction block and families, having their children taken, sold, like that's not that's not something to think just goes away, right? And so again, many people, our families say, you all get money to keep our children. You take our children and you sell them to other people. And I heard a Native American woman talk about that's what was happening, that Native American children was taken and being sold. And so when we hear families say that, sometimes people are like, that's ridiculous. We're not selling children. We're not there. That comes from history, right? And maybe your memory doesn't serve you well, but that's in the DNA. And the last one that we can fall into, we got to be careful. Many times we're like, I'm not racist, I'm not, but we got to be careful about this personally mediated racism. That's kind of the one where it's you against me, two people, right? We have the institutional, we have the individual, the internalized, and now the personal. So it's unintentional that we're upholding these particular societal norms. Okay, so the acts of commission or acts of omission, right? I'm not a part of it. I'm on the fence. I'm not, you know, count me out of this, right? But it maintains structural barriers and it's condoned by societal norms. So we have to look at our practice again, even if you're not in child welfare, look at your practice and see where we might be perpetuating those norms. I want to bring up the social worker code of ethics. And again, you'll see that this can be not just social workers, human services workers, healthcare workers. I don't think I realized when I was a social worker that this job was so social justice focused. I had no idea until I read the code of ethics. So social workers promote social justice. They strive to end discrimination, oppression, poverty, and other forms of social justice. And this third dot point can be seen in different ways. It can be seen in direct practice, meaning social worker to family, right? Community organizing, supervision, so our supervisors, consultation, our managers, administration, advocacy, social and political action, policy development, implementation, education, research, and evaluation. So whatever field that you're in, right, you can be ensuring that you're fighting for social justice for families. Sometimes, and we'll talk about that, some folks who are not social workers or do direct practice are wondering how can they impact. There are many ways. We'll talk about it. Also, enhancing the capacity of people to address their own needs. We'll talk about that. We talk about lived experience and their expertise and them being the expert of their families. Again, in our previous questions, we talk about families being, the expert, that we are not. Our job isn't to save people's children, right? And our job isn't to define what's safety for families. But people have, again, they are empowered already. We have to help them call that out. We don't have to give them power because we should not be holding power over families, right? So we're going to enhance their capacity to address their own needs. They know what's best. They've been taking care of their families for a long time. Very well. We talked about child welfare didn't, come up with kinship care, especially indigenous families, ancestral practices. They've always taken care of their own children without anyone asking them to. And so we need to understand that. And then lastly, promoting the responsiveness of organizations. So it's our job to, kind of push our organizations to respond, okay? To respond to communities, social institutions, individual needs, and social problems. So when we see something, we need to bring it up. And of course, this Office of Equity, it is my job to bring up, when I see things, inequities. And it does get tiring when some people are not open to that, or they're like, oh, here we go again, right? It's the harder thing to do. But that is our job as human services workers, healthcare workers, social workers. So let's get into how did we reimagine, right, our child and family well-being department. And I will say that, again, when I was a social worker, I was really upset about us only focusing on the child, because I had a family who, one woman, she was pregnant and I knew she had issues with substance use and that it would impact that baby. But at the time, an unborn baby was not considered a part of child welfare. When we had the family count, it was her and her child that was maybe a toddler. But they didn't count the unborn baby. But I could tell this woman's going to be back in our system. She's going to be back when she has this baby because she's already having, but I wasn't able to offer anything to her until the baby was born and something happened. as we saw in our timeline, we wait until, something happens and they have to, take on this label of child abuse and neglect to get services from us. And I always thought, even younger in my career, like, why don't we wrap around the family? Why are we focused only on the child? Like, the parent needs help too, and the grandma, and like the household. But it wasn't, thank you for that emoji, but it was not something we were doing 10 years ago. We were not looking at the family as a unit. And so we saw folks come in and out, like, and you are creating a list of child welfare history, right? And so if someone sees you have 14, cases in the past, you don't have a chance, right? Because we were not looking at the family as a unit. We were looking at that child, get that child safe, whatever that was. So one of the things I was really, happy with when I came back to child and family well-being later as Office of Equity was that we had this anti-racism journey that our director at the time was basically mandating and requiring leaders to do. So that's the first thing I would say is, get the leaders on board. That was really important, that leaders were on board, that leaders were able to identify, accept, and acknowledge that we do have systemic racism in our organization, and we have to do something about it. So we used mining for gold, and we still are using them. So this has been, I feel like, a 5-year journey, and I loved how slow the journey has been, because it really spends a lot of time on your individual work of anti-racism before you even apply it to what you're doing in the workplace. Like, what are your ideas? Are you able to identify, as we talked about, that personally mediated racism? Like, where am I perpetuating, right, these systems? Because I work in a system that is, a part of the systemic racism. So I can do everything I can, right, to point out inequities and things like that, but I have to also still acknowledge I am still a part of a system that has systemic racism, right? And how can I identify that? What work can I do to continue to enhance my anti-racism journey? So that's number one. So maybe find where your leaders can get some outside. This person was an outside consultant, excuse me, and really getting the readiness. When we talked about uh, readiness, how do you get your organization ready for what's about to come, right? Because there needs to be readiness, and I'll talk more about that in the later slides. We also designed a racial equity framework, and again, we had some outside consultants that helped us to develop this. But with those outside consultants, we also included our internal workforce. So that is also very important, to include our lived experience internally, right? We'll talk about lived experience of our community, but your particular colleagues have some lived experience as well, right? And they're experiencing things, and they can really speak to that. So we talked about racial equity and how race, poverty, and neglect run intersectionally, right? And we've seen where we have made some headway with our legal, where we have our laws talking about neglect not being conflated with poverty, because we kept seeing the same thing. It's the same race, they're living in poverty, and we're substantiating neglect for them. But then we found that when we look very closely, over 80% of our neglect cases were really poverty, right? Were really, they needed food, they needed housing, they needed those kinds of things. But we put neglect, right? And so we can't substantiate on that. So this racial equity framework really calls out how we are looking at different races and how we are seeing them again be conflated with their socioeconomics, and that should not be. So for instance, being unsheltered, that should not be an abuse or neglect. That's not us. But we'll talk about what we've done even when that's not us, right? Trying to help people understand that just because we don't do that, we don't do housing, right? We don't do CalFresh or food stamps. We don't, that's not our thing. But that doesn't mean we close that door, right? I heard someone also use language that I liked. Um, Instead of no wrong door, every right door, right? Every door is the right door. And so we don't have to say, sorry, that's not a child welfare issue. Go figure it out. And we'll talk more about that. So I want you to kind of, look at this. That we've seen many, I'm sure, images of what equity is, equality, and things like that. But I really like this one because what we've tried to do is pull in that justice piece. So the equity piece is very, very nice to have, right? Where we're giving special, different types of tools to families that need more help. But the real problem, again, is systemic. And justice, thank you for those emojis. I see those hearts. And justice is really what we need. We need to fix the system, right? And that's what we're trying to move into. So we did start with, everyone started with the DEI, right? And we noticed that we needed to move further in there. So when we talk about prevention, and you hear me talk about anti-racism, it's because that is the system, that is the structure that's upholding all of that, right? Next thing we did was the lived experience framework, and this is not ours. This is I think I might have dropped something in the resources for this, but I liked it because it talked about what we usually do when it comes to including our community in helping us develop a new system, right? To reimagine. And in our questions, we talked about do we, does community love for us to, get their input? And as you see, input is we've done it all, we've created it. This is what we think. What do you think? We've already created it without you, right? And so input is not the word, right? We found that families want to be a part of co-creation and co-design. They want to be at the table at the beginning, not after we figure things out. And that really showed that we were um, just not trusting of families, that they were able to sit at the table with us and start this thing and give great ideas about their families, right? That we had to come up with the structure and then we bring it to them. But not only did they want to be included at the beginning, but they wanted to continue throughout and get updates. And then even in the evaluation phase, they wanted to be included at each phase of the reimagining our system. And so I want you to be thinking about in your organizations, where are you when it comes to identifying, acknowledging, valuing lived experience from your community? So our lived experience framework talks about we can't do or create anything without our communities at the table, the beginning, right? And so when we said, hey, we are developing child and family well-being, and the community had so many questions, and we're like, we're developing it together, right? But they were so used to us having the answers, having things together, and we had to keep saying, we don't know yet, right? We're not sure yet. We're building it together. And that was really a beautiful thing. And so we want to move from, informing, hopefully we're not ignoring our families in our community anymore and their voices. We want to move to from informing to consulting, to involving, collaborating, and then deferring to. So that's a journey. that's a journey. I'll talk more about that. The next thing we did, which is a great example of this lived experience framework, is partners in equity. We have leveraged, because we can't do it alone, one. Two, we're a government agency, so we're limited in what we can do. And three, we had a very poor reputation with the families, right? And so we knew that we needed to partner with people, contract with people, organizations that could meet the families where they were. And so YMCA, everyone knows about YMCA, right? A very neutral organization that people kind of saw. What I hear them talking about is like a swimming gym. It didn't have that connotation of County of San Diego government. It didn't have a connotation of child welfare. It didn't have that negative kind of reputation. And so we were able to partner with them to include the community in their voice, in helping us to um, come up with solutions of how to engage with their family. So folks who were already system involved talked about what's going on currently with their case, like, not, obviously for confidentiality purposes, not the exact thing, but just like how they were being treated. This is what's happening when social workers are coming to the door. This is, so letting us know what they're seeing in real time, so that we can go back and we can, really tackle those things. But what YMCA was able to do that we aren't able to do, they were able to pay our families and our community members for their time. So we were all there being paid, right, as um, professionals at work. But we were asking the families and community to come in and help us develop something, and they weren't being paid. That was another thing that was not very, it didn't show the value that they had, right? We would just want your free labor, right? And so they were able to pay them. They were able to provide childcare during that time. They were able to also, provide breakfast and lunch. Um, and so we asked, what could get you to the table? Like what? And they come every month like clockwork. And it grows and it grows and it grows because we were listening. So that is another way that we've reimagined, really partnering with folks who the community trusts and that can do things that we can't. First culture is something that we've also embraced to reimagine our system, right? And that means that I heard someone say in a Ken First conference, it should be the first placement and usually the last. Um, Looking at their statistics, they find that this is so good that children stay in these placements longer. They do better in these placements, and usually it's their last placement instead of bouncing from place to place. Remember, I told you when we, have placed folks, children in families that don't speak their language. Thank you for that emoji. Don't eat the foods they eat. Don't have the religion they have. You start to get, identity crises. You start getting cultural crises, right? And so you start getting behaviors, and these families are like, wait a minute, I ain't signed up for this, right? But more than likely, grandma's gonna deal with all of your problems, right? I know my grandmother did, right? Whatever issues I had, she wasn't saying, oh, get rid of her, right? She was going to address those things. And she was equipped to do so because guess what? She was my bloodline. And so we find that families, obviously keep their children longer. And so Kin First culture is something we've also embraced, where we're not going to be placing children with strangers as a first option. We're going to look for their families. And so what we've done is we've hired family finders. I want to say we have 8. We apply for a grant, and these particular folks only look for families, right? And so before that was kind of on our other social workers, right, to find families, but they had already, large caseloads, as you know. And so we have people that are dedicated to finding families. And this also included fathers, something that I can be honest, as a social worker, I did not look for fathers. I did not look for fathers. When mother would say father's not involved, I would continue on. And so we haven't done a good job with, we talk about engaging fathers, but we haven't done a good job in engaging fathers, right? And it's not because they don't want to be engaged. I've also helped, as Office of Equity, I've helped us to develop interviewing language thank you, interviewing language for interviewing fathers. And one of the first things I had to say is, I'm not a father, nor am I a man. So my language is more geared toward a woman or a mother. So I might not be the right person. Let's get fathers involved. Let's get men involved that know how to talk to men and fathers, right? Let's let them tell us what it is. And so we have to also know when we are not probably the right person for the job. We have to, again, partner. We have here is the community response guide. I put these three together because it's so important. The community response guide, our mandated reporting to community supporting, and then the hotline to the helpline. So this is all about getting our community on board with reimagining prevention as well. So we're asking our community, hey, listen, don't call on your neighbor because they're yelling at their child, or you feel like they need food and the child never has food, or we're trying to educate also our mandated reporters, right? Our teachers, our medical professionals, our law enforcement. Get to know the family and what they need. Don't call us if it's not abuse or neglect, right? Identify what they need, get to know who they are, and refer them to the best possible place that can help them. And so the community response guide is still being developed, but it's there to kind of help people understand, is this a child welfare issue, or is this a need food or need housing or something else, right? Should I make this call? Should I make this report? And then again, that mandated reporting to community supporting. you know, this is where we call it the helpline now, or warm line, but the hotline folks, then this is their job to say, do you know this family? You're calling on Keisha. Do you know the family? Do you know if they have extended family? Do you know their religion? What do you know about the family? You're just calling, you don't know these people, right? And so we have to also acknowledge bias in our community, right? Because we're also judging, our neighbors. And so we have to ask more questions about why do you think that's problematic, right? And then also educating them that this is not an abuse or neglect issue, right? This is probably this. Do you think they would benefit from, getting a YMCA after school program, right? The mom's overwhelmed, the child has lots of energy, probably just needs to get in a sport, right? Really, really simple things. And then again, the hotline to helpline, where our helpline folks or previous hotline folks are being trained to ask more questions to those reporters that mandated or anonymous reporters that are not mandated, like asking them more questions about what's this call really about. So trying to retrain the community, because we've trained the community to just call and let us figure it out, right? And obviously, mandated reporters have a really hard time, with supporting, because of laws that say if you don't report, you lose your license, or things like that. And to that, I say, our job as mandated reporters to really shore up our resources where we have more things to offer than a call. So I was in a home as a social worker, saw a child running around, was on the spectrum, hitting his head. Mom was not supported, right? And the therapist called us, and that's fine. But I used my resources, right? That this isn't abuse or neglect. This mom is overwhelmed. And I have plenty of resources to give her to help her, right? One of them was her family, right? Calling her sister, calling her mother, letting them know she needs support, right? And they were like, oh, okay, simple. There's no need for removing anyone, right? So we have to relearn. Um, all of us. Next, we have the Family Connection Hub. Remember I said that we don't turn you around if, we don't do whatever it is you need. We have a Family Connection Hub, which is you don't have to get a case with us. We saw in our timeline where you had to say, hey, I abused or neglected my child to receive services. This Family Connection Hub offers, and this is from our Family First Prevention dollars. We say if you need services, you don't have to have a case with us. We will offer services if you need help. Now, remember I said I would talk about the limitations. Thank you for that emoji. The limitations of what we're doing. So the Family First Prevention Act offers certain things, right? Evidence-based. And that's something we need to work on because we know evidence-based is based on one person's culture, viewpoint, right? And so every culture isn't in there, right? So whatever's offered in that Family Connection Hub, that might not work for me. That might not work for this particular family. Thank you for that clap, right? And so that's a limitation of our Family Connection Hub. So we need to still work more and more. I want to see more cultural things, but we know the cultural things like African drumming, hula, powwows, those aren't considered evidence-based, but they are helpful to our families to heal, right? Culturally and ancestrally. And so that we have more work to do there. Our Family Support Liaison Program, this was formerly our Cultural Brokers Program that really focused on Black families because, again, culturally, if you are not of that culture, you might, again, subjectively decide that the way they're communicating, the way that they're acting is not, they don't care about their child. They're being aggressive. They're being, right? And so now the police is called. We never get, any kind of interview in and a child is removed, right? Because this person is fearful, right? You're at their door. Remember, we looked at the auction block, right? They're fearful, they're confused, they're upset, and they're responding appropriately, but we're going off of memory instead of history of why are they acting like that, right? And so this particular program has a go-between, someone to go between and kind of let them know, hey, let's work together with child welfare or child and family well-being and get, help you get the resources you need, get through this process. Okay. And so unfortunately, this one is, again, they do some prevention, right? They do some prevention, but many times they are doing intervention. So we have more work to do on that one. Faith in Motion is another one that we have done. Remember, I said we have to partner. We partner with the YMCA. Excuse me. We partner with Faith in Motion. So these are our faith organizations. Every faith you can think of, synagogues, church, mosque. We are partnering with them because guess what? They're a mainstay, right? Religion, spirituality, just like culture, right? Their cultural connections, their religion and spiritual religious and spiritual connections are a mainstay. And guess what? People trust them. They've been going. They don't have always the negative, again, connotations. Sometimes they do, that we do. And so we've been connecting with our faith organizations to help us with not only, sometimes we might find folks who want to be resource families, right, to help us with our children, but more than that, they act as care communities. So they act as wrapping around the family and saying, hey, I can bring dinner. Hey, I can bring such and such to soccer, right? If a child is being removed, or has to go to a family member and they don't have a crib, hey, I can get a crib. I can get a car seat, right? They act in that way where constituents of that particular faith organization, they want to help keep their children in the community and connected. And so they've been very helpful with that. This is they are so excited to be partnering with government. They never thought, state and church, as they say, would work together, but it's a really awesome partnership. And so what I do as Office of Equity, thank you for that, the hearts. The Office of Equity, that's me, what I do, some of the things that I do. I do a lot of things with I'm trying to make sure I'm on my time. Uh I do a lot of things internally for our workforce. And so I'm a big believer again in the knowledge that's in the workforce. And so what I do is I ask the workforce, would they be willing to share their backgrounds, their culture, their religion, whatever it is, with their colleagues to help them understand it more and also be able to interact with families. And so I have had lunch and learns with coworkers who are deaf and talked about the deaf community, those who are neurodivergent, um, Native American, um, Latino, and LGBT. And so we have really tapped into our workforce to share. And what it's done also is to help with our internal DEI efforts as far as our engagement with our coworkers, right? Just understanding more our coworkers and how different we are and where we're coming from and things like that, just improving the understanding. So that's something that I do. I also partner with stakeholders, the Office of Equity, hiring a diverse workforce, as well as getting a diverse pool of clinicians. Again, that's an area we need to improve. It's a very this is one that is the bane of my existence, and having not only a pool of clinicians that are diverse where our families can go and speak with someone who looks like them, but again, that array of services, right? I want to see those cultural healing modalities, right? And not just, again, the Western world view, the white world view of what mental health and healing and treatment looks like. Um, and recruitment efforts of families of color, because we know that they also, remember, the systems are interdependent. Excuse me, they're interdependent, and so that means that when we want to have families, excuse me, take in their children, they have a record. Let's say with sheriffs, thank you for that clap, they have a record already. They're not able to take in their niece, their nephew, their cousin, right? So that's another area that we need to really work on. And we have made some strides there where we have been able to waive some things, because again, we know that Black and brown families are disproportionately, involved in our justice system, but that also impacts their ability to, again, support their children if we want the children and their families, if we want to, utilize kin first, right? Um, I also review policies and practices, and I went ahead and left that in one of your resources, where you can use an equity assessment tool to kind of look at your policies and your practices and kind of ask the question: Is this inequitable? Is this equitable? Is this advantaging one group and disadvantaging another group? I also developed racial impact statements. And again, this tells us, how this impacts families, and gives recommendations on what would be best for that. And lastly, consulting with our workers for any racial or cultural considerations that they might have with cases that come up. This is our newest, I want to leave some time for questions. This is our newest endeavors, right? So those things that I shared earlier are things we've done, we're still doing. This is, something we're entering in, pretty new, still working on. And so we call it the Justice, Equity, Diversity and Inclusion Integration. So we need to be now looking at, to support these things, our budget, our contracting, and our data. So the budget, we have a budget equity assessment. Uh, what is the T for? I can't remember. I'll remember it later. But it is for us to look at where are we putting our dollars, right? And why. And in these particular budget equity assessment tool, Why are we putting our dollars there? What's the pros and cons of putting our dollars there, right? Um, and so we're not just, again, putting our money in places that, we've just always put our money there, right? And we're not looking at what communities are not receiving the kind of support they need. Remember, I talked about our money was going all to foster care resources in the beginning. We saw that image, right? And less on prevention efforts. And so now we have to justify our budget as far as how does it build equity. Contracting. We have now equity in contracting. Again, we have historically given contracts to those who have the resources, right? That are large, that have a staff, right? They have folks who can collect data and evaluation and things like that. But we know that the smaller organizations, the grassroots, the mom and pops, right, are much more effective when it comes to, again, that cultural um, and ancestral and just being in that community. Many times we might have contractors who are not in that community, right? But they just have resources, right? And they don't understand that community. But our smaller contractors are unable to get a contract because they don't have the people, they don't have the resources, they don't have maybe the know-how to navigate our grant process, which is gnarly, right? And so we want to look at how can we get those folks in there that know what they're doing, right? Know the families trust them, um, but they just don't have the infrastructure, right? And how can we help them with that? Thank you for that emoji. And then lastly, data. We found that sometimes we need to disaggregate our data. So one of the questions I asked when I first came on as Office of Equity is how many African American families follow up with the referral process for blah blah blah. And they were like, we don't know. I'm like, we should know that, right? So there's many questions we ask because this data could help us again make data-driven decisions, right? Where we want our money to go, where we want our resources to go, where do we want the contracts to go? If we have the data saying, hey, this particular group um, is experiencing different outcomes than this group. So that's something you want to think about as well as you're reimagining, your organization and you want to, drive change. You have to look at what you're doing with your money, your budget, what you're doing with your contracts, and then also what you're doing with your data. Lastly, this is the newest thing that we're looking at, which is the HOPE framework. Healthy outcomes from positive experiences. So we've always operated under ACEs, right? Adverse childhood experiences. Well, this framework, operates on PCs, which is positive childhood experience, right? So we talked about trauma-informed practices. This is a healing-informed practice. It has 4 building blocks. It focuses on relationships, the environment, also engagement in the community, and emotional growth. And so I've also, again, included those resources for you. If you want to, you can become certified in this particular framework for free. There's a Hope 101. And if you want to go further, if you want to get a facilitator for certification, you can then go in and train your organization as well. And so this is one of the latest things that we're doing, one of the latest frameworks that we're using as well for our organization to, again, drive that restoration and drive that healing and child and family well-being. That is it for me, and I'm happy to take any questions or thoughts. I see 26 messages in the chat. I'll see if I can see, but I love all of it.
Yes, the chat has been very active. I absolutely love when everybody's talking and discussing in the chat. There is one question though I wanted to read off in the Q&A. And so it's from Renee Kennedy. Have you been able to identify funding streams outside of FFPSA that funds true prevention? FFPSA primarily funds intervention.
Absolutely. Um, we do have very limited funds, yes, that fuels true prevention, like those concrete supports, like you said. Really, we're trying to leverage the community with that connection hub, that family connection hub. So we're trying to connect with and ask families, like, what do you want to do, what organization would you like to go to meet this need. And we do have some funds that can pay for those things, and especially in the extracurricular area, we have a pot of funds that allows to pay for extracurricular things for our youth, such as, baseball or dance and things like that. But you're absolutely right. Like I said, we have a lot of work to do with FFSPA to get around the evidence-based and that intervention piece of it. But we have been using it in our Family Connection Hub, where we do not require families to have a case to be able to get services from us. Thank you for that question.
Yeah. And then if you could, on that next slide, we're going to have some information for you all. It should just be perfect. Yeah. So I wanted to thank you all for being here today. And especially Dr. Clark, thank you for sharing so much information. It's so helpful for everybody who's here today. I hope they're able to take some things away. And it looks like we might have a few more questions that popped up as we were waiting. And so Renee also asked, are you considering using EDPs outside of the ones California has approved?
We're very limited in I'm just, evidence-based practices
Mhm.
to make sure people understand. We're very limited in our plans that we have rolled up to the state, and really bound by what they have approved for us to do. I've been pushing to get promising practices, right? And again, adding additionally to these evidence-based practices, but looking at those promising practices. And I think that our Native American community has done wonderful and beautiful work in this area of bringing attention to the practices that are outside of these evidence-based practices. And to be honest, if we look at the data, we've been using these evidence-based practices, but we've been having the same outcomes. And so I'm hoping that we look at that data and know that these are not as uh, helpful as we think they are for, again, communities and bodies of culture. These are not as effective as those cultural and promising practices that folks are using. As I said, folks have been doing these things before we came along. Um, and so just really listening to that. But right now we are bound to what the state has asked us to do, and that is those evidence-based practices for now.
Yeah. And
Thank
one
you for
more
that question.
question. Yeah, one more question from Fatima. Can you expand on the Family Connection Hub? Is it provided internally or outsourced to a community-based organization?
Yeah, thank you, Fatima, for that question. It is outsourced. We have contracted with a community organization. So again, we've leveraged so many partnerships because at the end of the day, we are still building our trusts back with the community. Again, the slides at the beginning really show we've done some major damage to our community. So the more it is with a trusted partner in the community, the better for us. And so it is outsourced to a community organization. It's not internal.
Great. And then I think that's all the questions that we have for right now. So Jennifer has dropped the link for you all in the chat for the survey. Once you click on that link, it should open up in a different window and you can fill out the survey. And then it will also lead you to fill out your information for the certificate of attendance. And so thank you all for being here today. And thank you for being so interactive and talking in the chat and giving the reactions. I know we mentioned it a couple of times. It really does help us understand what you guys are enjoying about the training and that you're really listening and involved. And so thank you so much, Dr. Clark, for being here today and sharing your expertise. I know our participants always will send some thank yous in the chat before they head out. So make sure to check those out. I know they love giving kudos to you, which you absolutely deserve. And so thank you all for being here today. We will stay here just for a couple more minutes and we will re-drop the link for you just to make sure it doesn't get lost for the survey. And then that will be it. So I hope you guys have a good Tuesday.